Welcome to Doc Talk. I'm your host, Mark Houston. We're celebrating the best of 2025 this month and revisiting some of our most informative and popular episodes from the past year. This week, check out episode 144, The Hip Preservation Institute, with Dr. Kenneth Milligan, orthopedic surgeon, and Dr. Eric Krohn, pediatric orthopedic surgeon. Based in Rapid City, the Hip Preservation Institute brings much-needed, highly specialized hip care to the Black Hills and the surrounding region. The goal is to prevent long-term hip deterioration through early intervention, minimally invasive surgery when required. To learn more about the Hip Preservation Institute, visit monument.health/hip preservation. Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and today we're going to give you the first look at something brand new that's coming to Monument Health, the Hip Preservation Institute in Rapid City. And this isn't just another clinic or department, from what I understand. This is a dedicated team focused on keeping hips healthy, strong, pain-free before any major surgery becomes the only option. And today, we're sitting down again with Dr. Kenneth Milligan, who is now like a 2 or 3 timer here on the show,
yes.
Right? And I guess Dr. Eric Krohn. I don't know which of the episodes you've done is going to go first, so we're going to pretend this is your first one too. All right,
Sounds
just to
good.
make sure.
Yes, glad to be here.
Yes, thank you.
Whole new
Thank
room.
you for coming in. So we're going to kind of pull back the curtain here on what this new institute will offer, how it's going to change patient care here in the Black Hills, and why, I think most importantly, hip preservation matters more than I think a lot of people understand, right?
Yes.
So let's start simple with this. What exactly is hip preservation?
Yeah, so I think really the main thing to kind of think about is hip preservation is aimed at treating painful hips that don't have arthritis. And so typically when we initially thought about hip pain, there were pretty much 2 categories. Patients who had arthritis who were offered total hips, and then patients who did not have any signs of arthritis who were offered nonsteroidal anti-inflammatories, maybe physical therapy, and told that that was all they could do, and to come back when they developed arthritis to have a total hip.
So really quick, just we've heard the term arthritis a million times.
Yes.
What does that mean in your hip?
Yeah, so arthritis is really probably the most simple way to talk about it is that in your hip, which is a joint like most of your joints, there is cartilage. And arthritis is really the destruction or essentially the wear and tear of that cartilage that's inside your hip.
So arthritis is cartilage damage,
Exactly.
cartilage damage, I guess.
Yes.
Okay.
Yep.
So is preservation obviously is like you kind of explained is different from hip replacement, right?
Yes.
Why is right now the right time to be bringing this into Rapid City, do you think? Something like this?
Because Dr. Milligan is here. No, but to be completely honest
there
with
a
you,
big need?
There is a big need for sure. So, I was here for a little bit of time before Dr. Milligan showed up, and there are a few patients that are now coming back and seeing me who I'd been just doing PT on, who now I can say, hey, there's actually something more that we can do here, whereas before, if they were to need these kind of surgeries, we would have had to send them out pretty far away. And I mean, as far as we're aware, there's not even someone in Sioux Falls that's doing these. Some people would go to Fargo, North Dakota. There are some people in Denver. But yeah, it's not even something that we even seem to have someone who does has this kind of background in the state.
Right.
And as I'm doing the younger kids, I'll deal with a lot of hip dysplasia on the younger side. But once their bones essentially become more adult, which is, depending on boys and girls, is around like that 12 to 14, the type of surgery that needs to be done is pretty involved, and that's what Dr. Milligan is specifically trained in, along with some other things around the hip.
Right.
And so that is why we are able to do this now with him being here, is because we can actually provide these surgeries that we really didn't have the skill set for before he came.
That's awesome. Only because it's because of where we are as a community, right? Yes. We're in the middle of
a lot
and nothing.
Space.
Yeah.
Yes,
right?
yes.
You know?
It's a lot of space.
Yeah,
yes.
you've got to go to Denver or Rochester or Sioux Falls or Fargo and for a lot of people that's just not realistic.
Yeah.
Right? Is that important to you? Both of you as doctors, that people get to stay here? I mean, that you get to see them on a regular basis. Does that help?
Of course. I mean, our goal obviously always is to treat the hip pain regardless of if it requires surgery or not. But for those patients that do require surgery, having a surgeon that is closer and more accessible is definitely helpful in case you need to come in because there's concerns about your incision or you just had questions. And so being closer is definitely advantageous.
Right. Now, why is the hip? Is it the joint in your body that seems to go out the most? Because it seems like you talk to a lot of people that have replacements or issues.
I'm sure that the number is out there somewhere, and I probably knew it at some point.
Yeah.
I would say it's probably hip versus knee, and I'd say probably hip is higher up there. Okay. And maybe not everyone gets a hip replacement, but a lot of people end up developing some type of problem with their hip as they get older.
Now, I understand. Obviously, we use our hips to sit, to move, to walk, to all of these different things. Why do they wear out so much? I guess I don't know why. It seems like a lot of the other joints in your body don't do that. Is it just because they're used so much?
Yeah, I mean, I think that is probably a large part of it is that there is a joint that bears a lot of weight across it. It pretty much all of the force from your trunk and upper body passes through your hips and independently. So especially when you're running, but even in walking, you load one side and you're loading one joint with all that force. So it's a lot of force.
Well, some people can go their entire lives without a problem, though, too, can't they?
That's true. Yeah, definitely. And there are people out there with some hip dysplasia, actually, that you might even find on an X-ray, and there's no guarantee that they would be someone who would develop issues down the line.
What is hip dysplasia?
Yeah, so I think probably the other. I'll kind of go back to one of your questions of just what hip preservation is. Obviously, it's the treatment of patients who have pain without arthritis. But one of the kind of important parts to that is that when you're looking at that question of who gets arthritis and who doesn't get arthritis, we do see that there are certain things that predispose patients to getting arthritis. One of those is hip dysplasia, which is where your socket is maybe not properly fully formed, or that it doesn't come around your femoral head or the ball of your hip fully. And so that can then lead to abnormal biomechanics and breaking down of that cartilage prematurely. There are other conditions that can also cause that. One that a lot of times we'll talk about is femoral acetabular impingement, which is where people can have extra bony growth either on the socket or on their femoral head or the femur part, and that can then pinch the labrum and then eventually cause damage to not only the labrum but the cartilage, and can also predispose you to arthritis. And so, this, I think one of the special things that we do is really kind of addressing hip pain, but also trying to screen for these particular conditions that we can hopefully maybe intervene and preserve the hip so that you don't develop that premature arthritis and develop arthritis at an early age.
So just kind of catching it ahead of time.
Exactly.
I mean, obviously. Well, for people that are listening who have hip pain but haven't seen a doctor, what are the early signs that they just should not ignore when it comes to your hips?
I would say deep growing pain with activities.
Yeah.
Or just even pain with activities that just, especially if it's the kind that starts and you stop doing your activity and that pain is staying around, you really fire it up. I mean, your hip should not be hurting with every time you're taking a step or doing a jog or something like that. And deep growing pain is the classic area where people they feel hip pain.
Now, when you say groin pain, where in the is it right in the front?
Right in that front where the crease is in between your thigh and your and your genital area. That is the area where you'll feel deep groin pain.
So it's really not on your like on the side.
It can be, but not the
Most-
classic
okay.
one. People might say, oh, I feel like I had a groin pull, or I keep having a groin pull, or something like that.
no
And
kidding.
that might be a sign that, well, it's something is injured in there, but it's not the muscle in your groin that you're pulling. It's pain coming from the hip joint that you're perceiving in that area, and then that's what some people might diagnose you with. It's just a groin pull.
Well,
When it happens
yeah.
over and over again. That's something to...
I guess if I would have felt that pain, that's exactly what I would have thought. I would never have considered that's
that
my
the hip
hips.
joint could be
Yes.
Yep.
Yes.
Yep.
That is really good advice for people to hear.
Yes. Yes.
For sure.
If you feel that, come and see us.
Yeah, absolutely. Now, what kind of patients are going to benefit most from an institute like this? Is it going to be athletes, weekend warriors, every day?
I would say probably who might benefit the most, just because going after just like how much time they could benefit, it would be the younger kids, or it'd be the younger adults and the older kids, like in that adolescent group. Because if you can find their hip issues early, there might be a chance you can treat them with just therapy, and they have some micro instability. You just have to make their so the hips moving around a little bit, and that's what's causing pain. You do some good directed therapy, they're a lot stronger, their pain goes away. Well, that's fantastic. They didn't need surgery, and then hopefully that's just some extra exercise they need to do for the rest of their life. But no, I would not say that it's just that group. They just have the most years to potentially have hip problems, and you kind of nipped it in the bud. But no, we're around for Dr. Milligan will definitely do hip issues in the full gamut of ages. I will do hip issues in the younger groups, and in that kind of young adult group, that's where him and I really convene on if these are ones that need to proceed with some larger surgery.
Okay.
But I mean, we'll do that larger surgery, and even up to 30 years old sometimes. And just because you're in your 30s and you have hip pain doesn't mean that you need that surgery, or there isn't something we can do. There are other things we can do with the other people in our institute, like the physical therapists, the sports medicine doctors with their ultrasound and their injections. So who benefits the most? Numerically, probably the younger people, but everyone, if they're having hip pain, could come and see us, and we would, even my wife, who's a general surgeon, is someone who we can consult if their hip pain turns out to be hernia pain, which is something that can also happen in that area. So
you guys must, do you work together? You guys?
Yes.
Okay.
Yeah.
So walk me through at least how would somebody's care happen under your guys' watch at this institute, like from start to finish? How does that work?
Yeah. So I think one thing to kind of consider is that I think a lot of people who are coming to us have probably had hip pain for a fair amount of time, and they may have already seen other people. And they may have been told it's a growing pull, a sprain, been giving, nothing you can do. And so usually they've seen several different people, and then they will probably at some point, if they choose on their own, or maybe their primary care doctor may refer them to either me, Dr. Krohn, or probably Dr. Metzler as well.
Who's a sports medicine physician?
Who is one of our sports medicine physicians, yes. And so from there, usually at that point, we'll do a full kind of physical exam and get their clinical history, and also get a lot of imaging. I think one of the very important parts of this is that we do utilize a lot of advanced imaging, CT scans and MRIs, to really be able to figure out what's going on with the hip. And then once we have all of that, a lot of times we will discuss me and Dr. Krohn together, Dr. Metzler as well. She does a lot of diagnostic ultrasounds for us, and so she will actually ultrasound and watch how the hip is moving to assess for instability. She also does some very targeted injections and can do some physical exams with injections to kind of help to identify where the source of that pain may be. And so kind of the combination of all of those and then us kind of talking together, we can kind of decide what is the best treatment option for the patient. One of the benefits and why I think now is a great time for starting this is that there are a lot of people who are kind of coming here. We've kind of hit a critical mass of patients who providers who have some very unique skills and talents and are able to kind of do that. And so we also have physical therapists who have been at some quite big hip institutes as well. And they also are very experienced and trained with treating patients with hip pain, obviously non-operatively, with
Right.
doing exercises and other modalities to help with their hip pain.
So this institute then is going to be bringing a lot of people from a lot of specialties together.
Most definitely.
For sure. That's great.
Well, and like we said, the hip pain might come from something else. So that's why we have general surgeons, that will, if it turns out, this is a hernia that we can't fix, because you don't want us doing hernias. We can and pull them up. We ideally, they would be seen by someone in the institute. So either Dr. Metzler, myself, or Dr. Milligan. And if that's the first provider they've seen, we'd hopefully get some x-rays and, you have some concerns for, hip dysplasia, a little bit of impingement. And that's the person who then we say, okay, first you go to therapy, and they can hopefully go to our institute therapists and get very directed therapy. Or even plenty of the other therapists can do this stuff too. And then if that's not working, then we talk about going to Dr. Metzler for then those diagnostic injections to say, hey, let's find out exactly where this pain is coming from. We'll probably have MRI and CT scan around that time to check what their overall deformity is and see if there's any obvious soft tissue injury. And then after all that is done, if the injections have shown that, hey, that pain's coming from the hip joint, the x-rays show that there's some bony deformity, then we say, okay, now we start talking about surgery.
So it is, because I'm sure a lot of people hear hip preservation,
Yeah.
and they instantly think, well, that's surgery. It's always surgery, right?
Yeah.
And obviously, you guys are well trained in it, but it's something I think you don't want.
Answer.
Yeah,
Yes.
It isn't the only answer to this, for sure.
Yeah.
And
And I think that is an important part of the Hip Preservation Institute and the people that we have is really to highlight that not all of it does require surgery. One of the maybe common areas that people may be referred to somebody for evaluation of their hip is for patients who have labral tears. And they may get an MRI of their hip and they may see on there that there's a labral tear or a gluteus medius tear. And they may be referred to someone that they have to have surgery. And it's not always that if there is a labral tear, especially in pediatric patients, that they need to have surgery. Or that if they do, that the surgery that they need is just to fix that labral tear. And so I think that's an important part is that sometimes, hip hasn't been properly or not properly, but it hasn't been looked at a lot, even in the medical profession, until very recently. And so as we have started to look at that more, they have kind of latched on to a couple of different things. But I think when we really are talking about the hip, it is a little bit more complex than just a labral tear that just needs to be fixed. And sometimes it doesn't require surgery at all. And then sometimes it does require surgery, but it's not just a labral tear that needs to be fixed.
There's a reason why that labrum torn.
Right, exactly.
The hip is a joint with a lot of conformation. They are very socked in there. This is not like a shoulder, which is pretty much a dish and a ball, and then the labrum there is what holds that in there. So if your labrum's tearing in your hip, it doesn't always mean this, but there's a good chance that there's some bony deformity that's been underlying and that's why it tore. And so you go and get the labrum repaired, and fantastic, the labrum's sewed back up, but the bony deformity never changed, so they go out and do things again, they get another labral tear. And that's just exactly what would happen with these people if they don't get that addressed. They continue to have that soft tissue and cartilage injury, and that eventually leads to arthritis.
Okay. Well, there we go. We almost came full circle of that whole thing back to arthritis. That was great. What's one of the most common myths or misunderstandings that you hear about that you would love to clear up right away?
I mean, I think that is one of them. Is definitely that if a labral tear that needs to be either addressed. A lot of times, if we're talking about young patients, they really shouldn't have labral tears. And so if a young patient has a labral tear, there usually is a bony abnormality that may be causing that labral tear. Older patients can get a labral tear as part of just wear and tear. And so if it's a 50-year-old, 60-year-old who has a labral tear, that's not so much something that needs to be surgically repaired. That's something that we need to kind of optimize with non-operative treatment, and then maybe down the road they may need to have a hip replacement. Probably the other big misconception is that I think it's very helpful to know that growing pain can be hip pain, but that might be one of the other misconceptions
That's
too.
the only pain.
Is that the only hip pain is growing pain.
Right.
Because patients can present with all different types of pain. It can be buttock pain. It can be pain on the outside of their hip, pain kind of up higher on their pelvis. And all of those pains may be indicating hip pathology or a problem with the hip. And so if you're having any kind of hip pain, especially pain with range of motion of your hip, you should definitely, try to seek evaluation of that pain.
When it comes to taking care of your hips, are there things you can do to lessen a lot of these things we've talked about today?
I think that would be a tough one with some of the things that, the reason why we're surgeons.
Right.
If it's something that's going to need surgery,
right,
it's probably not something that you're going to be able to fix at home. But
right, exactly.
If you're someone who we evaluate and we say, hey, we're a little worried about your bony alignment, and we put you into therapy and the therapy works, well, then the most important thing, I think, is doing the home exercises with therapy. But to say that there's something that people should be doing at home to just, like your back, or you're supposed to always lift in this position and whatnot, there's not really good ways to just save the hip. I'd say the bigger thing is if it's hurting, don't ignore it. Another PSA for you is if your kid is quitting sports because they're hurting, bring them in. I won't say for sure that we will find the problem, but especially with a lot of the people who we have, the younger people that we've signed up for the involved surgery where we really move that bone to help with the hip coverage. These are people who were active and they've quit all their sports. Kids aren't supposed to do that from pain. Like if you don't want to, okay, I'm not going to be able to fix that. Right. But if they're saying they hurt and I don't want to do gymnastics, I don't want to, go and do my cycling, I don't want to do track, that's not something that a kid should be saying. Yeah. And there may be something else going on.
Well, you'll see, and I'm bringing a lot of this back to around terrible advice that you get on social media. TikTok specifically.
Yes.
But people will be showing you lots of exercises you're supposed to do that supposedly can help your hip, help the joints, help everything stay lubricated or whatever. How much of that's BS and how much of that is, I'm assuming too, overweight must also be, is that a thing as well?
That would be a huge factor. Okay. Yes, you're overloading your joints.
Right.
And it's just, then that's something you can control.
Yeah.
You can't really control your skeleton. You can somewhat control your muscle mass, but just your overall amount of weight that you're carrying around, if you can reduce that, that will make your hip pain better. And that would be, if someone comes and sees us and that's a major factor, that's also in that non-operative management. Like, well, let's see if you can lose some weight and this makes your hips feel better. Mm-hmm. If you've got a little mild dysplasia, maybe that extra weight is what's really causing it to load that edge. You drop 20 pounds, and I'm just guessing.
No, right.
And then your hip pain goes away. Well, then you're probably someone who doesn't need surgery. We just need to keep it up.
Yeah. Right.
But in terms of the stuff you see on TikTok with, stretching and range of motion, I think yoga and that kind of stuff is fantastic for your overall, just health and well-being. You're stronger, you're more flexible. But if you have a bony issue that is causing soft tissue breakdown, stretching your hips out is not going to be the thing that saves you. Yeah. It's not like, if you just stretched your groin out, you would have been fine.
That's kind of big news, honestly, though, really. Because a lot of people think, well, how much, and this is, I don't know how off track this is getting, but how much muscle is in there? Is there a ton that's around there?
Yeah.
Now having, so let's say guys that squat or do things like that with their legs, is that bad for your hips or is that helpful when you're developing those muscles?
Good.
Is it good?
Yeah.
Is it really?
Yeah.
Up to a point.
Of course.
Yeah. So, I think that if you have these bony abnormalities, you're going to notice a problem with squatting and doing those, and either dysplasia will kind of sometimes cause that, or if you have a big cam deformity and you're doing a lot of deep squats, you're going to notice that, and it's going to be painful.
That
you can't,
that we were talking about.
And that's where you impinge, and so you can't stretch past that. That being said, there are a lot of people who have a lot of tightness of their muscles, especially their hip flexor muscles, and they can develop back pain as a result of that and hip pain as a result of overly tight hip flexor muscles. Also, the muscles on the side of your hips that we call your hip abductors, or those muscles as well can a lot of times actually be underdeveloped. and especially in even active patients like runners, especially, who will have a lot of weakness there, and they may develop hip pain, and it really has to do with just needing to really work on some of those lateral stabilizers of the hip.
Well, I didn't want to hear that I had to start working out more. I was hoping that wasn't going to be a thing, but all right, very good. It's always good to know.
Yes.
That's what we're here for.
Doctors are never telling you to spend more time on the couch, unfortunately.
I know, as soon as I can get that podcast started, that's going to be great.
Yes.
Spend more time on the couch. Yes.
So, listeners who may be dealing with hip issues now but are nervous kind of about getting help and getting started, what is your best advice to get them moving in the right direction and to get them, to this Hip Preservation Institute to get help? Well, what would you tell them?
Yeah, so I mean, I think we're rolling out this big marketing push, and so definitely any of the providers that are in there, and you can go onto the website and see the providers that are part of that, and you can always call Monument Health and schedule an appointment with one of the providers and to initially be seen. And I think that would be a great place to start.
Sure.
Like I said, we do have some excellent physical therapists as well here locally. And they're also used to also working with some of the physical therapists around town, also to kind of help modify and know what to work. So even if you're, maybe looking at this and you're in a couple cities away from us or a couple 100 miles away from us, we can still kind of help with either directing physical therapy and directing some of that care as well. But at least it allows you to have a diagnosis. And I think that's one of the important parts is that we really want to get a diagnosis for you. Yeah. And then we can direct our treatment, not necessarily doing a treatment and then seeing if it works or not and then trying another treatment. What we would like to do is to get you a diagnosis and then kind of structure our treatment around that.
Well, I think this is just going to be, as we mentioned earlier, this is going to be huge for Rapid City. Just for the fact that, again, people with this pain and with these issues, they don't have to travel. Yes. That's the biggest deal. So, I'm super excited for this. And I know, having talked to both of you guys here before, that you care about what you do, you're passionate about what you do, and, you want to just make sure everybody lives the best life they can live with whatever they've got, right?
That's what we're here for.
Dr. Kenneth Milligan and Dr. Eric Krohn from Monument Health and the Hip Preservation Institute, thank you both for coming in and talking. I appreciate it so much, you guys.
Thanks, Mark. Appreciate it.
Thanks.